Hi, my name is Caitlin Nijkamp, and today I will be discussing post-polio syndrome. So moving on to diagnosis. Diagnosis of post-polio syndrome is attained by looking at a detailed look at the patient's history, a neurological examination, and the process of rejecting other possible diseases. So symptoms of post-polio syndrome include muscle weakness, muscle pain, and fatigue. This syndrome is slow progressing and occurs later in life for some individuals who had polio in the past. For etiology of post-polio syndrome, the cause is unknown, but the main theory for the reason why post-polio syndrome occurs is that there is a gradual deterioration of nerve cells in the spinal cord that were damaged by poliomyelitis. But there is also another possibility, which may be due to a viral infection, fatigue of overworked nerve cells, brain damage, or even a combination of both could happen. So the pathophysiology of post-polio syndrome involves dysfunction of an excessively developed motor neuron, neuromuscular joint defect, reactivation of the polio virus, immune system dysfunction, and the process of neural loss, which results in premature aging. So prevalence and incidence of post-polio syndrome include prevalence of post-polio syndrome is 28.5% of all paralytic cases. It is estimated that 25% to 50% of all the 300,000 polio survivors in the United States may develop post-polio syndrome, and incidence peaks at 30 to 40 years after the initial illness. Related populations and lifespan considerations of post-polio syndrome are individuals who had a short episode of poliomyelitis, and females have an increased chance of developing post-polio syndrome, and that the syndrome stays with the individual for the rest of their life. Some disorders that are related to post-polio syndrome include ALS and multiple sclerosis. Some risk factors for post-polio syndrome involve older age when contracting poliomyelitis, poor socioeconomic conditions, and the risk for post-polio syndrome is highly increased among patients who sustained substantial permanent impairment after poliomyelitis. For medical management of post-polio syndrome, it includes joint and soft tissue pain, and management of this involves modification of body mechanics, such as bracing, assistive devices, or mobility aids. Then for management of muscle pain, it involves preventing pain by modifying activity and stress on a muscle. Management of fatigue involves optimizing body mechanics and cardiovascular health. One way to prevent and manage cold intolerance would be to insulate with layers of appropriate breathable clothing. Lastly, medication, injections, and sometimes surgical interventions can help for management. For precautions of post-polio syndrome, there is currently no way to prevent post-polio syndrome. There is also no intervention that has been discovered to delay the decline of surviving neurons. Recommendations for individuals who have post-polio syndrome include getting a proper amount of rest, maintaining a well-balanced diet, and following a prescribed exercise program, and limiting unhealthy habits. Occupational therapy services related to post-polio syndrome include occupational therapists start by evaluating the patient's occupational role, then inquire about what activities cause pain, weakness, or fatigue. They look at how these symptoms affect present-day occupational roles. Occupational therapists check the fit and the function of the equipment that the patient is currently using, and they perform manual muscle testing if there is any weakness in the upper extremity. They also focus on non-fatiguing strength exercises, re-educating in ADLs, use of assistive devices, modification of work and home environments, and education in job simplification and energy conservation. Also, occupational therapists help patients with upper extremity problems, mostly overuse injuries, and recommend adaptive equipment for home/office. In my next slide, There will be a video that shows how occupational therapists may help individuals who are diagnosed with post-polio syndrome.
Pauline's mission was to meet with Margaret Petkoff, the occupational therapist at Polio Services Victoria. An occupational therapist can offer an assessment of how an individual polio survivor is living and managing their energy. People like Margaret can quickly establish if a person is wasting energy on basic household tasks simply because their home is not modified properly.
The role of occupational therapy is a varied one, primarily because it's a client-focused service. And also the age ranges of the polio survivors varies from young adults or even older teenagers to quite elderly people. So the sort of things that occupational therapy would look at are really related to people's activities of daily living, and those sorts of things would include their personal activities of daily living, so how people manage in their home environment, whether they're having difficulties in relation to performing showering and dressing, toileting, accessing their home, getting in and out of their bed, getting on and off a kitchen chair, and also whether that person is at risk at home of falls as a result of difficulties with their mobility. It's a matter of them identifying to me what their problem is, and we work together to try to solve that. And because people's houses are varied, their social circumstances are varied, the sort of intervention I provide will be very different to different people. We also look at community type intervention, which would be looking at people's access to the community. So if you've got somebody that's having difficulties accessing their local shops or their doctor or those sorts of issues, then I would be discussing that with the client and then working out whether they need maybe a scooter or an electric wheelchair. Really, there is no real recipe for occupational therapy. It really is very much dependent upon the client's needs at that time, and that's influenced by their living arrangements and their social situation, and also whether they work as well.
Hi, my name is Caitlin, and for my activity today, we're going to be doing 3 non-fatiguing exercises, and these would be beneficial for our patient who has post-polio syndrome because it would help restore their stamina and endurance. Okay, for the first one, we're going to put our hands on our knees. Then we're going to lift our hands up over our heads. Then we're going to bring it back down. We're going to do 5 more of these. So up, and then back down. 1. Then again. And 2. 3. 4. And 5. Okay, for our next exercise, we're going to put our hands up in front of us, and then we're going to turn to the right, and then we're going to turn to the left, and we're going to do this 5 more times. So right, and then left. So 1, 2, 3, 4, and 5. For the final exercise, we're going to bring our leg up, and we're going to try to extend our knee up towards the ceiling for our right knee first, and then we're going to rotate to our left. We're going to do this 5 times. 1, 2, 3, 4, and 5. Thank you for participating, and I hope you enjoyed my video and activity. Have a great day. These are my references. Thank you all for watching.